Hi there, nice to see you.
Hi.
My name is Dr. Samita.
Hi.
So I heard from the receptionist that you have some abdominal pain. Can you tell me more about this?
Yes, it's last night. It's middle of night. I feel very bad. His stomach is so hurt. So and also I just did vomit. And after I feel my stomach still is hurting.
Did you vomit at all today?
One time this morning I did one time.
So there's been vomiting. Have you been feeling nauseous?
Yes.
Okay, so nausea and vomiting. That's a little bit concerning. So I'm going to have to rule out a few cases that are serious, okay? So did you have any pain before vomiting?
No.
Okay. No pain before vomiting. Are you having a fever at all?
No.
No fever? Well, we can check that as well.
Yes.
Have you had any diarrhea?
Yes.
Yes, okay. Have you had any other changes to your stool?
No.
Like, for example, a change in color or...
No.
No? Okay, that's good. No blood in the stool or vomit? Any blood?
Is have a vomit,
But is there blood in the vomit?
No.
Okay. Blood and vomit, that's a good sign. Okay. Clearly you're not constipated. No constipation. Okay. We're going to talk about your pain. How does your pain feel? Like a tearing pain?
No.
Okay. Does it feel... Was it sudden?
No.
No? Was it crampy?
Yes.
Yes. Okay. Crampy pain. Okay. And can you tell me where you feel the pain?
Yes, a whole stomach.
The entire stomach?
Yeah.
Okay. So diffuse, non-specific pain, and it's crampy. So last night before you vomited, what did you eat?
Is I eat sushi.
Okay.
I just ordered from outside. Yeah.
So you ordered takeout. Did you eat from this place before?
No, this one is first time I ordered
First time
this
ordering
restaurant.
Okay. That might be where the problem is coming from, but I do have to check a couple other things, okay?
Okay.
So I do want to know, so from 1 to 10, 1 is being just very little pain, 10 is the worst pain you ever had. How bad was the pain?
About 5 or 6.
5 to 6. Okay. You're feeling that still right now?
Yeah.
Okay. And I want to ask you, does your pain move to your back?
No.
No? Does it move to your shoulder here?
No.
This shoulder?
No.
What about your left arm or your neck?
Nothing.
Okay. No radiation to any areas. So I can... That helps me rule out a few serious causes, including MI. So I'm going to go ahead and start by doing your vitals. Take your temperature. Let's open up your mouth. I'm going to put under the tongue, close it, hold on to it. Okay. I'm going to come over here on this side and take your pulse. Okay? Check your temperature. Okay. It's a little bit high.
Mm-hmm.
So it's at 37.5, which is kind of a mild fever. But you don't feel too hot?
No.
Okay. I'm going to take your blood pressure. Okay, just relax down here. Just waiting for that pulse to disappear. Okay. Just raise your hand and pump your fist 10 times. Relax your elbow onto my arm. Okay. Your blood pressure is very good, actually.
Mm.
Putting on a pair of gloves for your protection. Okay, I'm just going to do a general inspection. Looking at your face. Can you open up your eyes for me? Checking to see if there's any jaundice of the sclera. Okay, no, I don't see it. Okay. Looking to see if there's any rashes. Okay. Okay. All right. Can you please lie down? Good. Okay. I'm just going to drape. There's that. It's okay. Just going to tuck this right in. Good. Just going to bring this right up to here. Good. Okay. I'm going to start with an inspection of your abdomen, looking to see if there's any rashes or any striae. There's no Cullen sign. The umbilicus is midline, not protruding. Good. Overall, your abdomen has a very symmetrical shape, no protuberances of any kind. Also looking to see if there's any peristaltic waves or pulsations. Just from the surface, I can just see your breathing, but no real peristaltic waves. Okay. So I'm going to go ahead and auscultate and start with your right upper quadrant. Listening for bowel sounds. Getting some pressure there, and definitely see or hear some hyperactivity. Okay. Come over here on this side. Even more hyperactivity on this side. Okay. Now let's check your left lower quadrant. Okay. Definitely hear quite a bit of activity by the sigmoid colon. And over here on the right lower quadrant. Okay. All right. Now I'm going to listen for any bruit. So we'll start with your abdominal aorta on the top there. And we're going to switch over to the other side. Okay, no signs of bruit there. Now checking your renal arteries. Okay, then your iliac arteries down here. The other side. I can hear the pulsation, but I don't hear any signs of bruit, which can suggest atherosclerosis. Now I'm going to go ahead and percuss each quadrant. And I'm listening for any dullness, so far it's mostly timpani. There. Let me just. Okay, but it is scattered. There doesn't seem to be a major mass. Timpani. A bit of dullness here, but this could just be because of the bladder. Okay. Okay, might have to check the spleen on that side. And again, over here, there's some dullness. Okay. Now that I'm done percussing, I'm going to be palpating. I'm going to start over here on the right upper quadrant. Just let me know if you feel any tenderness. Actually, can we just raise your knees slightly like this? Yeah. Just let me know if there's any tenderness or pain.
A little bit.
A little bit? Okay. Let's check on this side. And this side?
Yes.
A little as well. Okay. And down here, lower left quadrant.
Yeah.
Okay, so just all over. What about here? Here too? Okay. I'm going to go a little bit deeper. Okay, relax. Try to relax. There's a little bit of guarding there. Okay. Just trying to see if there's any masses. Again. Relax. Just a little bit of guarding there. Okay. thing I want to check. Can you turn over to this side and cough? One more time? Okay. So there's no umbilical hernia, so that's good. All right. Now we're going to go ahead and I'm going to come over to your right side and check your liver.
Okay.
So now I'm going to check the size of your liver. We're going to be percussing mid-sternally first. And just start and up here. And then from here, we're going to start up here. Mid-clavicule. So start right here. Okay. So go here. Then from the bottom. So now I'm going to go ahead and measure. About 5.5 centimeters, which is normal. It should be between 4 to 8. And then from here, I have about 11.5 centimeters, which is also normal. And I'm going to go ahead and palpate your liver. So I'm just going to have you take a deep breath in and out. Good. Deep breath in and out. Okay. Try again this way. Deep breath in and out. Deep breath in and out. Deep breath in. Okay. I did feel a little bit of the edge of your liver, and it seemed completely smooth. There were no hardnesses, and overall it's not enlarged. Now I'm going to palpate your spleen. Just going to come over here. Take a deep breath in and out. 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 Okay, deep breath in and out. Deep breath in. Okay. The spleen is not palpable. I can also come over to the other side and percuss it. Okay. So I'm going to find the anterior axillary line and the last intercostal space. Sorry. Breathe in. Breathe in, please. And breathe out. Okay. Anterior axillary line. Breathe in. And out. now I'm going to go ahead and palpate your kidneys. How are you feeling right now? You're okay? All right, it's almost done. So I'm going to just find your costovertebral angle. You can relax. Relax onto me. Good. Right here. Okay. Can you take a deep breath in and out? No enlargement. Can't feel it. Come on the other side. Okay, deep breath in and out. No enlargement. Okay, I want to do the costovertebral angle test. So can you please get up? So for this exam, I'm just going to, and then I'm just going to find the costovertebral angle. Okay. Any pain?
No.
Okay. Costovertebral angle here. Any pain?
No.
Okay, good. So now I'm going to be doing a few tests for the appendicitis. Since you have a little bit of a fever and you're having, diffuse pain, this could be an early sign of appendicitis, and especially if it's periumbilical. So we just want to check just to make sure. So what I'm going to do is find the umbilicus and the ASIS and go about 2/3. Do you feel any pain?
No.
Do you feel pain now?
A little bit.
Just a little bit? How about this side?
Just a little bit.
Okay. And last but not least, we're going to do some more tests for appendicitis. I'm going to do the obturator muscle test. Just relax. And I'm just going to turn your hip like this. Any pain?
No.
Good. Okay. One more test. I'm just going to move this up like this. And can you please resist against my hand here? Okay, just resist. Like this way. To this hand. This hand. Like this. Do you feel any pain?
No.
Okay. Good. You can get up now. Okay, so your liver seems fine. Spleen is good. Kidneys are fine as well. That's all good. Your appendicitis tests all came back negative. So that's good as well. I also checked your arteries. There were no problems in terms of bruit. Your vitals, you have a bit of a fever, nausea and vomiting, and the abdominal pain, which is all over. Since I've ruled out the more serious causes, I would like to say that most likely your abdomen pain is caused by gastroenteritis. So that's basically the stomach flu, which was probably from the sushi that you ate yesterday. Okay, so I'm going to suggest that you go home, you rest, drink lots of water, and you're just going to have to get this out of your system. But if anything changes, if the abdomen pain gets worse, if there's any pain, especially on the right side, that can suggest appendicitis. So I want you to call me right away, okay? If anything changes. But this should be gone in a couple of days, hopefully. All right, so just keep me posted. Thanks so much for coming in. Take care.